Seattle woman had a seizure earlier this year. Doctors at Swedish Medical Center thought she may have had a brain tumor, but during surgery they discovered it was something much more unusual.
And the pathologist was able to look at it under the microscope and see the characteristic, actually the amoeba in the tissue.
An amoeba is a single-cell organism that can cause fatal disease in humans, and they live in warm soil and water. Swedish Medical Center didn't identify the patient, who died just a month after being diagnosed, but Dr. Cobb says she most likely became infected by the amoeba after treating a common sinus problem with tap water.
We believe that she was using a device to irrigate her sinuses that some people use called a Neti pot, and it's extremely important to use sterile saline or sterile water. I think she was using water that had been through a water filter and had been doing this for about a year previously.
Dr. Cobb says the woman carried an amoeba called Balamuthia mandrillaris, and it kills the brain cells slowly over time.
This is extremely rare. This amoeba was not even known 20 years ago, hardly, and there have been about 200 cases worldwide.
The Clinical Infectious Diseases Journal says 90% of patients that contracted Balamuthia have died. Although becoming infected is rare, Dr. Cobb says people should always follow instructions and take precautions when using medical devices.
That if you do use a neti pot, for instance, you should be very aware that it has to be absolute sterile water or sterile saline.
Most cases of brain